Popping isn't gross when it's done right. It's controlled wound care. Today, I'll show you pro-safe techniques to remove what's ready, protect what isn't, and wake up clearer without wrecking your barrier. The DEEP framework. Decontaminate, evaluate readiness, emollient warm-up, precision methods, don't force rules, inflameless aftercare, vigilant recovery, everyday prevention. Wash hands, trim nails, nitrile gloves if you have them. Sanitize tools, 70% isopropyl plus hot water rinse. Lay clean tissues, cotton, and sterile saline. Remove makeup, sunscreen, double cleanse, oil 60s, gel 60s, and pat dry. Evaluate readiness, green, yellow, red. Green, visible whitehead with a soft center. Open blackhead that's raised. Yellow, closed comedone, no opening, or deep tenderness, usually not ready. Red, cysts, nodules, no head. Widespread inflammation, active eczema and dermatitis, do not pop, treat only. Warm towel glide, gentle breathing. 2-3 min warm towel steam on the area. Optional, thin film of non-comedogenic oil on blackheads for 60s, helps loop glide. Blot dry, mist a calm toner, centella, heartleaf. Precision methods demand immaculate preparation. Sanitize any tool before it touches your skin to prevent infection. For metal tools, submerge the tip in 70% isopropyl alcohol for 30 seconds and let it air dry on a clean paper towel. Single-use items like cotton swabs must be fresh from the package. And of course, your hands must be freshly washed. First, identify your target. A blackhead is an open pore, clogged and oxidized dark. A whitehead is similar, but sealed under skin as a small bump. Distinct from both are sebaceous filaments, natural, grayish dots, often on the nose, that channel oil. They are a normal part of your skin. Each requires a different approach. For a confirmed blackhead, we use the loop tool. First, stretch the skin taut to anchor the pore. Place the smaller loop slightly past the opening. Then, with low, even pressure, gently roll the tool back over the pore. The goal is to coax, not force. If the plug releases easily, blot the area with a saline-soaked cotton pad. If it doesn't move after 1 or 2 gentle attempts, stop. Forcing it causes trauma and potential scarring. For a mature whitehead, cotton swabs are gentler. Position 2 swabs at a 45-degree angle on opposite sides. Press gently inward, and then sweep upward. The motion is a lift, not a pinch, to avoid rupturing the follicle wall. If the contents release, blot the area clean and follow with a tiny dab of a salicylic acid spot treatment on the opening. Now, let's return to sebaceous filaments. Remember, these are a necessary feature of your skin. You cannot, and should not, eliminate them. The goal is to manage their appearance. A consistent routine is key. Use a low-strength BHA solution 2 to 4 times a week, and complement this with a brief enzyme cleanse to dissolve surface debris. If you must extract a prominent filament, use only the gentle loop roll technique. Never follow up with pore strips, as the aggressive pulling can stretch pores and trigger rebound oil production. Certain blemishes are non-negotiable zones for at-home extraction. Deep cysts, hard milia, and inflamed ingrown hairs require professional treatment. Attempting to use needles at home risks deep infection and scarring. Similarly, avoid any forceful pushing on the delicate skin of the eyelids, under-eye area, and lips, as this tissue is easily damaged. Rule of 2s. If it doesn't release in 2 gentle tries, stop. Pain spike, bleeding, blanching, or shiny skin, shots, abort. Limit total extractions per session to 10 to 12 small lesions or 5 minutes, whichever comes first. Immediately following extraction, your aftercare routine is critical to prevent inflammation and promote healing. Begin by gently cleansing the treated area. A sterile saline solution on a soft cotton pad is ideal. Sweep over the spots without applying pressure, then carefully pat the skin dry. Avoid any rubbing, as this can cause irritation and disrupt the healing process. The goal is to clean the site without causing further stress to the skin. Next, apply a microdab of a targeted spot treatment. A 2% salicylic acid or 2.5% benzoyl peroxide formula works well. Use a clean applicator to place a dot-sized amount directly onto each opening to keep the pore clear. To calm redness and soothe the area, gently glide an ice roller over the skin for 30 to 45 seconds. For any spots that were true whiteheads, apply a hydrocolloid patch. Leave it on overnight to absorb any remaining fluid and create a protective barrier that prevents picking. Avoid applying any makeup directly on treated spots for at least 12 to 24 hours to prevent clogging and infection. If you must wear makeup, use only a light mineral-based powder applied with a clean brush, and be sure to steer clear of the immediate extraction sites. Do Gentle Cleanse Soothing Toner, Centella Heartleaf, Gel Moisturizer, Ceramides plus HA. Don't Heavy Acids, Scrubs, Retinoid or Sauna for 24-48H on treated zones. AM, SPF 30+, non-comedogenic, UV darkens healing marks. Night Rotation, Night A, BHA Zone Press, Nose, Chin, Soothe, Gel Moisturize. Night B, Retinoid Adapalene Pea Size, Whole Face, Moisturizer. Night C, Recovery, Barrier Serum only. Micro Habits, Pillowcase, 2 to 3 times week. Wipe phone daily, cleanse within 10-15 min post-workout, wash brushes weekly, avoid heavy occlusives on the T-zone. Hands off. If you want to touch it, patch it. So what can you expect? The results are both immediate and cumulative. Same day, you'll notice a significant reduction in that uncomfortable pressure and pain from inflamed lesions. Ready-to-go whiteheads will look visibly cleaner and flatter. Within 7 to 10 days, you'll start to see a real change in texture. Your T-zone will feel noticeably smoother, with fewer fresh plugs forming. And the long-term payoff? After 4 weeks of consistent, gentle application, you'll see a visibly calmer breakout cycle. This is especially true when you limit extractions to only when necessary, and pair the DEEPDIVE method with a supportive BHA or retinoid rotation on alternate nights. Remember, the goal is progress, not perfection. Now, I want to help you personalize this. If you're planning to use the DEEPDIVE method tonight, drop an emoji in the comments so we can see this community in action. For a more tailored approach, comment with your skin type, oily, combination, or dry, and your toughest zone, whether it's your nose, chin, or jawline. I'll be pinning a customized mini-map routine just for you. Your engagement helps this channel grow, so please like this video and share it with anyone who struggles with extractions. And of course, subscribe and hit the bell for more barrier-safe skincare that actually works.